Hello, everyone. Welcome to our next presentation in this series of wellness forums on managing stress. So these programs are a joint production of the Department of Psychiatry and the University of Iowa Hospital's COPE team and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller. I'm a clinical associate professor in the Department of Psychiatry and director of the psychology division in our department. Before we go further, I want to announce some important information. This webinar is provided for informational and educational purposes only. It does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to your nearest emergency room. If you think, no provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees or any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. So today, I'm very excited to introduce our speaker and her topic. There will be time for a limited number of questions at the end. You can submit that through the chat portion of the live stream. The topic for today is stress and insomnia. I am hearing from many people lately that this subject is very relevant during the COVID-19 pandemic. People are having difficulty sleeping, they're waking up early, they're having worry thoughts that keep them awake. So today's program will give you information about insomnia and stress. Our presenter today is Jenny Clark. She is a certified rehabilitation counselor and a licensed mental health counselor. She provides neuropsychological rehabilitation services through the Benton Labs in the Department of Neurology. Today, Jenny will discuss the relationship between stress and sleep, as well as cognitive behavioral strategies to address insomnia. Here, without further ado, to tell you more is Jenny Clark.
Thank you, Laura. And thanks to everyone joining us today. You know, there's no question that the COVID-19 pandemic has changed all of our lives. Whether you're a healthcare worker on the front lines, working remotely from home, or homeschooling your children, it's normal to experience increased levels of stress and anxiety. In addition to changes in your normal daily routine, you may be experiencing feelings of loneliness related to social distancing practices, worry about the spread of the disease and the health of your loved ones, or facing financial challenges. As a result, your sleep may be affected. Today, I'll discuss the relationship between stress and insomnia, strategies to improve your sleep, and relaxation techniques to help manage stress. Now, stress has been long known to be linked with sleep problems. To better understand this relationship, it's helpful to discuss the body's stress response. When we're confronted with an actual or perceived threat, the brain sends signals to the rest of our body to prepare it for action. Our sympathetic nervous system functions like a gas pedal in a car. It triggers the fight or flight response, providing the body with a burst of energy so it can respond to danger. When this happens, a number of physical changes occur, including increased heart rate, faster breathing, muscle tension, and increased mental alertness, all of which are incompatible with sleep. Our parasympathetic nervous system acts like a brake. It promotes the rest and digest response that calms the body down after danger has passed. Now, if the brain continues to perceive something as dangerous, the body stays revved up and on high alert. This alertness is what can trigger insomnia at night. Now, insomnia can look different for different people. It can be trouble falling asleep, trouble staying asleep, or waking up earlier than you intended. What we'll do next is discuss some strategies you can use to put the brakes on your stress response and improve sleep. First of all, it's important to wake up at the same time every single day, regardless of what time you fell asleep the night before and regardless of how much you slept. If you vary what time you wake up, every day, you can create the same kind of fatigue that you might experience with jet lag without even traveling across time zones. Also, if you compensate for lost sleep at night by sleeping in, it'll be a lot more difficult to fall asleep at night. Second, you should use the bedroom for sleep and sex only. If you spend a lot of time awake in bed or doing things that you would normally do during the day, like watching TV, eating, or working, you may actually train yourself to stay awake in bed. We call this conditioned arousal because over time, the body starts to associate the bedroom with wakefulness. So for those of you who might be working from home right now, I would recommend setting up a workspace in your home that's separate from your bedroom and generally spending the majority of your time in your living environment. Now, if you have trouble falling or staying asleep, the best thing you can do is get up, move to another room, and engage in a quiet activity until you're sleepy again. This could include reading, doing a crossword or jigsaw puzzle, or practicing relaxation. You just want to stay away from activities that might be too stimulating, like using electronic devices, exercising, or reading about the pandemic. Once you start to feel sleepy, return to bed. This will help you fall asleep quickly. If you find yourself worrying or ruminating in bed, again, get up and stay up until you can return to bed without these mental activities interfering with your sleep. If you continue to have trouble shutting off your thoughts at night, you might find it helpful to set aside some time during the day to do the thinking, worrying, or problem solving that you need to do. The time you set aside for this, keep in mind, should not be close to bedtime, and you shouldn't do this in the bedroom. It's also good to avoid daytime napping. Napping, particularly in the afternoon or evening, can interfere with your night's sleep. However, if you're feeling sleepy while doing something you need to do to be alert, like driving or operating heavy machinery, it's okay to take a short 15 to 20 minute nap to make sure you stay safe. You only want to go to bed at night when you're sleepy. We know that spending long periods of time in bed can lead to shallow and fragmented sleep. You should really only spend the amount of time in bed that you need for sleep. So for example, if you're spending 9 hours in bed, but only sleeping about 6.5 or 7 hours, you should really reduce the amount of time that you spend in bed to about 7 hours to help consolidate your sleep or help you fall asleep quickly and stay asleep. And lastly, it's important to schedule wind down time about an hour or so before you go to bed at night. This is time that serves kind of like a transition period between your day and the time that you go to sleep. In regards to sleep hygiene, it's important to avoid substances that can interfere with sleep, like alcohol, caffeine, and nicotine. A lot of people notice that drinking alcohol tends to have a sedating effect. It helps you fall asleep. However, we know that as the alcohol levels in your blood system decrease throughout the night, this tends to have a wake-up effect. So you might wake up frequently throughout the night or wake up earlier than you intended. It's good to make sure that you're exercising regularly, but not too close to bedtime. For people who have insomnia, the best time to exercise during the day is in the afternoon, typically when we have a lag of energy after the lunch hour, because this helps give you some energy for the rest of the day and really helps build your sleep drive so that when you do go to bed at night, you fall asleep quickly and stay asleep. It's good to avoid blue light emitting devices before bed and throughout the night. We know that these lights can stimulate the brain and make it a lot more difficult to fall asleep and stay asleep. There are some different blue light blocking filters out there now for our devices. A lot of iPhones, a lot of tablets have these devices, and you can certainly make sure that you have these filters on in the evening. But I would also keep in mind paying attention to the content of the material that you're reading or what you're watching, because this can also kind of trigger the body's stress response and make it more difficult to sleep at night. You definitely want to keep your bedroom dark, quiet, comfortable, and at a cool temperature. These tend to be the best circumstances for sleep or best conditions. And you want to avoid consuming heavy meals right before bedtime. It's certainly okay to have a light snack if you're hungry, but generally avoiding those large meals. All right. So, given the relationship between stress and sleep, it's important to learn how to manage your stress. Regularly practicing relaxation techniques like deep breathing, imagery, and progressive muscle relaxation can help you manage stress during the day and sleep better at night. You can practice relaxation for about 10 to 15 minutes, 1 or 2 times a day, or before bedtime as part of your wind down routine. Relaxation should be practiced in a comfortable chair and in a quiet setting without interruptions. You can begin this process with some controlled breathing, slowly taking a deep breath in through your nose and then exhaling from your mouth. When you do this, you should notice your stomach rising and falling with each breath. Practice this with your eyes closed for a few minutes. Continue with controlled breathing and develop a mental image of a peaceful, relaxing place. Use your 5 senses to experience this place in as much detail as possible. Imagine what you would see, what you would hear, taste, smell, and feel. If you're envisioning a beach, for example, you might imagine a clear blue sky, the sound of waves crashing on the shore, the smell of salt water in the air, or maybe how the breeze feels on your skin. After a few minutes of deep breathing and imagery, you can begin progressive muscle relaxation. Starting with your facial muscles and working your way down your body to your toes, tense and hold each muscle group for about 5 seconds before fully relaxing it. Try to coordinate your breathing with this by inhaling to tense and exhaling to relax. When you're finished with this process, continue with controlled breathing and rebuild your mental image, paying attention to how your body feels and enjoying the state of relaxation for a few minutes. Now, if you're interested in free resources that offer guided exercises, there are a number of apps available on smartphones, websites available. My personal favorite is www.mindful.org. And this is a website that offers daily mindfulness-based practices that can be really helpful for practicing these types of relaxation strategies, either throughout the day or, again, as part of your wind down time before bed. You will be able to review all of these sleep recommendations and relaxation resources on the Wellness Forum website today. And just to review, experiencing bouts of insomnia during times of stress is common. But I'm hopeful that these strategies will help you cope with stress and help you improve your sleep during this pandemic. Thank you.
Thank you so much, Jenny. I thought that was very helpful with many ideas for how to improve sleep and manage stress. I have a few questions for you. The first one is, I know that many people really also wonder if medicine to help them sleep is something that they should do, or whether doing some of the things you recommended is something they should try first.
Sure, of course. I think that's a really good question. A lot of people wonder, when they experience insomnia, if medication is appropriate or not. And, I will say that I'm not a medical doctor, but from what we know about research and insomnia is that these cognitive behavioral strategies tend to be more effective in treating insomnia in the long run, and they have less side effects than sleep medications. So, for example, cognitive behavioral therapy for insomnia is considered by most doctors as the first line treatment for insomnia. And, these are strategies that you can use throughout your life to help improve sleep. When you stop taking a medication for sleep, insomnia unfortunately returns. So I would suggest incorporating some of these behavioral strategies first to kind of see how that helps improve sleep, and then talking to your doctor if you still have some questions about sleep medications and if they can help in the short term for you.
Wonderful, thank you. Another question is about teenagers in particular. They, especially at this time, I think, being able to be in touch with their people by, by chatting or being on their phones with their friends, that kind of thing, is very important to them. But at the same time, what you were saying is that before it's time for sleep, there should be some wind down time. Do you have any advice for teens?
Yeah, definitely. Well, like I said, everybody's daily schedules are significantly changed right now, and teenagers not being able to see their friends in school or at sporting events or extracurricular activities, that certainly makes it difficult. So I can really appreciate and understand, people wanting to connect virtually online to stay connected. Now, as I had mentioned, yes, it's a good idea to make sure that you're avoiding blue light emitting devices before bedtime, typically about 30 minutes to an hour before you go to bed. And I think what might be helpful for teenagers especially is, and for everyone, is kind of setting up a schedule or daily routine where you can schedule time for, communicating with friends or kind of catching up maybe in the afternoon or early evening, so that when you do go to bed or right before bedtime, you can more so dedicate that towards reading or spending time with family or taking a hot bath or shower to kind of help you relax. But kind of encouraging teenagers or anyone really to set aside some time during the day to make sure that you are getting that social connection, I think would be kind of the best step for that.
Thank you. That was very helpful. I'm also wondering, do you have thoughts for people who do like odd shifts if their schedule isn't regular because their work shifts aren't regular? Is there anything that's helpful for them?
Yeah, that can be really challenging, especially when you have rotating shifts or you go back and forth between second and third shift. I know we have a lot of doctors and nurses and a lot of healthcare workers now who don't have a normal first shift. So what can be helpful the most is if you have the opportunity with your work schedule to kind of just stick to one shift. That's really important. So working primarily second shift or working primarily third shift and not switching between the two would be ideal, because again, we want to make your circadian rhythm as entrained as possible. And one way that we can do that is by waking up at the same time every day, whatever that might be for you. And sometimes what can be helpful with working different shifts too is using bright light therapy. Particularly when you wake up first, using some bright light therapy for 30 minutes to an hour when you first wake up to kind of reinforce that wake time. But that is certainly challenging, and I know that we have a lot of healthcare workers right now in that situation.
Yeah. Thank you. Last question. You talked about the importance of spending some time before bed doing some wind down types of activities. Do you have suggestions for things that people do that are good wind down activities?
Yeah, definitely. And again, this is to promote more of a relaxation response. So this is where we really want to stay away from stimulating activities like exercise or reading upsetting information about the pandemic. So some appropriate activities, maybe reading a book, it might be enjoying some quality time, playing some games with family. It could be relaxing by taking a hot bath or shower, listening to an enjoyable podcast. Again, you just want to stay away from those stimulating activities or those blue light emitting devices.
All right. Well, thank you so much, Jenny. That was very helpful. We appreciate you sharing this practical advice and ideas about how we can all take steps to sleep better and manage stress. A recording of today's live stream will be available later, right after this program, actually on the Loop, and also links to some of the resources that you mentioned and others that you provided to us. Tune in tomorrow. No, not tomorrow. Tune in Tuesday, for our next wellness forum. We have Dr. Kim Hart talking about moving toward what matters. And until then, please take care, and we look forward to seeing you soon.